So Bruce, after meeting our guest today for the first time, and what we're going to get into our partnership with them in a later segment, I actually was moved to sign up for an emergency preparedness class for the kids. I don't know if you've ever taken a class.
No, I haven't, but I will say that I did work at the Children's Hospital Association for a couple of years. And, as between the two of us, we have 7 kids. And I was trying to count up, and I think I've been to an emergency room with my kids at least almost a dozen times at some point between the 4 of them. And I just would say that, as a parent, there's almost nothing more terrifying or concerning. You feel so helpless when you have a kid that's gravely ill or injured, and it's really hard to know what to do. So I think it's great that you signed up for an emergency preparedness class.
Aside from earaches and urgent care visits, I have not had to take my kids to the ER yet in a panic, but I do hope to be prepared if that should ever happen.
From First Focus on Children, this is Speaking of Kids. I'm Bruce Lesley.
And I'm Messellech Looby. Speaking of Kids is a podcast that puts kids at the center of public policy.
And I think that the important thing for parents is that really the system should address this. And consequently, one of the things we're really looking to see is that hospitals need to have the appropriate training equipment and personnel and recognition that children are not little adults, and be prepared to deal with kids in an emergency situation. And that is a very different thing than when adults present in emergencies.
Yeah, Bruce, I think for most parents, you just assume that your local hospital or your community hospital is prepared to take humans of all ages, from babies to adults. And I think that is something that we should expect or have the expectation of our healthcare system. But we know from today's guest that that is so far from reality. For parents, when you're in a moment of panic and you're just trying to get your child services, you may not know, hey, it may be better for me to drive 27 minutes instead of 16 minutes to the hospital that's closest to me. But when you get there, you find out that they're just not prepared to treat a child. They don't have the right equipment. They don't have the right staffing, and the staff don't have the right training. And
the consequences can be severe. And so I think that's why we're really happy to have our guest today to talk about how we need to improve the healthcare system and emergency care management system in this country so that it really does recognize the special needs of kids and treats them appropriately.
Phyllis Rabinowitz co-founded the Our Baby Foundation in 2006 with her husband Andrew after the loss of their 9-day-old daughter, Rebecca Ava, after a misdiagnosis in the emergency room. Phyllis, welcome to Speaking of Kids. It's a pleasure to have you.
Yes, welcome.
Thank you for having me. Looking forward.
I know this is a difficult and deeply personal topic for you. This is a mission that is surrounded by passion and dedication on your end. But just for our listeners, can you share a little bit about the Our Baby Foundation and why you created this organization?
Yes. Our baby started after we lost our child, Rebecca. So for any parent, it's a nightmare losing a child, but losing a child over something that could have been preventable is an absolute torturous nightmare. So in 2006, when our daughter Rebecca was born, we brought her home from the hospital, and unfortunately, we felt like she had very alarming symptoms. So we were extremely worried. So she had lethargy and labored breathing, and she wasn't eating well. So we rushed her to the emergency room, and I have an older child, and I was never an alarmist before. So we just knew in our gut like something was wrong. So when we went to the emergency room, we were met with doctors that were pretty dismissive, and we wanted to believe them because as parents, you want to believe, that your daughter's going to be okay. But they were just like, it's a common cold, let me get to the real emergency down the hall. But we're like, something's not right. We know it. We know it in our gut. And with all of our pleading, we wanted to believe them. So we brought her home. And unfortunately, we had to go rush back to the emergency room the next day, and she had passed away. And what we later found out after the autopsy came back is that she had an enteroviral infection and sepsis, which went misdiagnosed. And if she had been readmitted and gotten supportive care, she could still be here and alive today. So there were so many things that went wrong with that scenario, the communication, but most importantly, there was a lack of pediatric training in that emergency room system. There's such varying degrees of pediatric preparedness in our emergency system, and it's a national crisis, and people don't know about it. And I started Our Baby 18 years ago with my husband, and we've been working on it ever since because there's a wrong in the world, and we need people to know about it, and we need to make change, and enough is enough. And we really need to hold people accountable, our politicians and stakeholders. And I'm really proud of the work that Our Baby's done. We had named it Our Baby after Rebecca, and it also means all of our babies because we do improve healthcare for over 1 million children a year in the United States, and we train 1,200 hospitals, and we do lots of great work. And I'm really proud of the work that we do. It's life-saving work, but we are a Band-Aid, and we really need to have more change come out of our efforts. And I'm a parent, I'm a citizen, so it shouldn't be our responsibility. And I just really hope that through this podcast and other awareness and our work that we'll talk about with First Focus, that we can make bigger change with the right people who should be held accountable.
I totally hear you on all of that. And, we have a whole field in the world of medicine, right, called pediatrics. And it's exactly what you talked about, which is it's a recognition that children are not little adults and they have unique healthcare needs. And I worked for a few years for the Children's Hospital Association, and just seeing the differences, and it's everything, right? You have to have different, even blood pressure cuffs, and a multiple because kids grow, and you have to have different things to intubate. You have to have different lines for IVs. And if you're not equipped and you don't understand that, as you've highlighted, it can be a huge disaster. What are some of the differences in your work over the years that you really see that are so important for ERs across the country to really adopt so that they can take care of children properly?
I'd like to say that the top pediatric experts in the United States understand this issue. It's very well documented in the medical community. Just a lot of parents don't know about it. So there are actually national guidelines. Like the changes that we want to make they're proven, they're attainable, and they're actually cost effective. So I always say it's training, equipment, and supplies. But there's so much more that goes into that. Like you alluded, the right medicine dosage, the right intubation, there's checklists that is out there from the pediatric experts of what is needed in every emergency room. Number one, the biggest change that a lot of people with us are trying to make is that there's a pediatric care coordinator in every ER. It's been proven through research, if there's a pediatric care coordinator, that they will make sure there's the right training, equipment, and supplies in each of the ERs. So that is like a first step that we need to make sure there is that pediatric care coordinator. And just to go back, just so people understand, how babies and children really aren't mini adults, they actually show symptoms differently, which is, unfortunately what happened with my daughter. They have different physiological responses than adults. They can't communicate their symptoms. And the fact that we all know, but we don't think about that we take our children to pediatricians, not our internists, for a reason, right? It's a specialist. There's so many reasons why our systems are failing children. Our emergency systems are not set up for children. They are set up for adults.
Thank you so much for telling your story, because as a parent, this is something that so many people are unaware of, and there's so many things that you have to proactively prepare for as a parent, right? Just even by way of diapers and wipes and just the basics. But typically, you're not necessarily proactively thinking about what you're going to do in the event of an emergency. And oftentimes, when something does happen, your default is, well, let me just go to the closest emergency room. When, depending on where you live, that may not be the best outcome for your child. Can you talk a little bit about, from a parent's perspective, what things they can do to just understand the different levels of pediatric emergency care and what is available to them around their community so they can map things out in the event of an emergency?
Sure. Exactly what you said. You research your schools for your children, you research, your car for yourself, but you should research your emergency room because right now it's not being regulated by law yet. So you should absolutely research your emergency room. The first thing you can do is call your closest emergency room and see if there's a PEC, see if there's a pediatric care coordinator, which I talked about before, because they'll make sure that your ER is more likely to be prepared. You can also go on the app Find ER Now, which will tell you by zip code, by hospital, like which ER is actually designated to help children. When you call to ask about the PEC, you can ask if there's continuing training and education for pediatrics in that ER. My favorite piece of advice we always give is always demand that second opinion. If your parental gut instincts are telling you, you have to advocate for your child. You know your child best. In my daughter's scenario, we really did try to plead, but there's something called a patient advocate in many hospitals. You can ask and demand for that second opinion if something isn't sitting right. Really listen to your parental gut. And then just be knowledgeable that emergency rooms aren't created equal. So obviously, if there's a breathing issue, like any doctor would tell you, go to the closest emergency room so you're stabilized and you can be transported to the right place. But if time allows, you want to make sure you go to a place that is set up for children to have your best outcome. I don't know if we're ready to kind of talk about some of the staggering statistics, but unfortunately, 1,400 children die each year in emergency rooms because of lack of pediatric preparedness. That's crazy to me. One of my favorite analogies is the airline industry. Would you board a plane with your family if you knew that it lacked the necessary training or tools to reach your destination? You wouldn't take your family on that flight. If the pilot wasn't trained or prepared or didn't have the right equipment, you wouldn't go on the flight. So airlines have the checklist, and so ERs should have the checklist, and you need to make sure that the ER is prepared for your child by asking those questions, being an advocate. I mean, can you imagine if 1,400 people died each year on a plane? We would ask for answers. So, this has been going on too long.
Absolutely. And it's one of those things too, where you're seeing these proliferation now of there's ERs, emergency rooms, but now there's urgent care clinics. To me, that word is very similar. So I'm really worried that this is in some respects going to get worse in some cases because these urgent care clinics are even less set up, right? This is really important, this message that you are delivering to parents across the country, because parents need to know, and we do need change dramatically. We need policy change. And I wanted to tell our listeners they can read more about some of this in our show notes, because we're going to have links to your website and to the Wall Street Journal articles on this. What were some of the findings that they had, and what has been some of the aftermath of that from your perspective?
Sure. And just so you know, anything that we gave them is all well documented in the medical community. So that's why parents may not be aware, but the medical community is. And what they have shown is that 80% of children are seen in non-pediatric ERs. And those are the ones that aren't ready necessarily for children. And unfortunately, the US ranks a D+ in pediatric emergency readiness. So that was a shocking uncovery. I think the Wall Street Journal also did a really good job of highlighting recent stories. I mean, they shared my story, but that was 18 years ago. But this is still happening. We're getting stories. The Wall Street Journal uncovered stories. I mean, my heart breaks. Just a couple years ago, a 3-year-old girl, Avery from Texas, was improperly intubated with an adult-sized breathing tube, which caused lack of oxygen to her brain, and her heart stopped, and she died 6 days later. And that was all due to the lack of pediatric preparedness. So I thought the Wall Street Journal, even beyond the stats, did a really good job of, highlighting that these stories are still happening. Of course, there's people working on this to make it better. Our Baby partners with the top pediatric experts. It should be more urgent. It should be happening faster, and the changes are attainable, proven, and cost effective.
No, absolutely. And there was legislation passed, the Emergency Medical Services for Children, decades ago, but it just isn't doing the job. It's providing some funding for states to look into this issue, and they fund maybe a staff person and they provide some information. But this is something that every parent needs to know. And also we need to reform the medical system. You can't just hang a shingle that says emergency room unless you really are able to take care of children as well, and do it in the right way, just like you said, like having a PEC and having the right equipment, the right training, et cetera. And so I guess the next question I think our listeners would be interested in is sort of the work you're doing to really address this issue and ways that maybe they can get involved.
Sure. So we raise money from anyone that understands the issue and the urgency of it, that then funds children's hospitals, that then train non-children's hospitals to make sure they're prepared for kids. So a lot of our programs are around training. So simulation training. So we have these baby mannequins that the entire medical staff in a hospital will be trained on, will act and respond to different medical situations. And simulation training has also been proven to save lives. And so we have plenty of stories, great stories from doctors and nurses that have gone through our training and feel so much more confident and capable of treating children after our simulation training. So that's probably one of our biggest programs. We partner with Yale Medical Center on that with Dr. Mark Albach. And we have lots of different programs. We do sepsis training with Marcel Medical that then trains other hospitals. We have EMS programs for the pre-hospital setting to make sure that the ambulances are ready. We do online training like internationally to make sure the latest pediatric findings are out there. That we do with Columbia University. We have lots of great programs that increase the pediatric preparedness in our emergency systems. But again, we're a Band-Aid. And I'm just a parent and I'm just a citizen and I don't want to be doing this forever. We want to hold the appropriate people accountable because, there are national guidelines that can be implemented. I mean, it's very interesting to note that our healthcare budget is $4.5 trillion, right? So to fix this problem, which is $150,000 per hospital, is like, $750 million a year. So it's pretty cost effective compared to our, $4.5 trillion budget too.
Coming up after the break, Phyllis tells us how we can do better for our children by ensuring they receive proper health care in emergency rooms.
I work with doctors that always say, children are getting subpar health care than adults, and they're the most vulnerable, most important people in our lives. So why aren't we prioritizing them? Because they can't speak for themselves.
Stick with us.
Making the world a better place for all children can seem like an impossibly huge task. Some of you may be thinking, I'm just one person. What could I possibly do to make a difference? I'm Leila Nimatala, Vice President of Advocacy and Mobilization at First Focus on Children. And I'm inviting you to join us and become one of our volunteer advocates, whom we call our ambassadors for children. Ambassadors are our most active child advocates who raise critical issues with the U.S. Congress and with the administration related to child policy and funding decisions, both for kids in the U.S. and worldwide. But don't take my word for it. We asked one of our ambassadors to share her experience.
I am Katie Landa. I live in New York City. I currently work as a researcher for an institute called the Child and Family Research Center at the University of Illinois, Urbana-Champaign. I joined the ambassador program because it's important to me to participate in working towards public policies that support children and their families. And I would encourage you to become an ambassador if you would like to become a part of a very supportive and warm network of people that values teaching and learning and activism towards creating a more just and caring country. Thank you.
So please join us, won't you? Check out campaignforchildren.org/ambassadors on how to become a First Focus on Children ambassador and to link up with our fabulous community of committed child advocates.
First Focus on Children is a bipartisan advocacy organization dedicated to making children and families the priority in federal policy and budget decisions.
First Focus moves beyond individual issues to serve a more important role, child advocacy. We educate lawmakers and the American public about the issues facing children.
To learn more about our work and ways that you can become an ambassador, go to firstfocus.org.
Coming up on State of Play, we will talk about First Focus on Children's partnership with the Our Baby Foundation. First Focus and Our Baby now have partnered together to really elevate this and raise awareness of this important issue at the federal level with policymakers. And to your point, Phyllis, I don't think there's anything more frustrating, because this is a big point of frustration for me. And a lot of the issue areas that we work on is when there's a clear roadmap to solve this problem, right? And that, to your point, the investment and the return on your investment is great. Like, what's greater than 1,400 lives of children, right, every year that could be avoided? Through this platform, through this podcast, a lot of our listeners are parents, grandparents, caregivers, teachers, people that are around children. What steps can you recommend that they take to elevate this issue at the federal level, at the state level, at the local level, within their communities, to really move this needle?
I will tell you that in 1 second. I also wanted to note that the 1,400 that you just mentioned again, unfortunately, the children that pass away, has been recently told that that's underestimated. And there's also thousands more that are disabled and have poor outcomes with lack of pediatric preparedness. So the issue is actually worse. But as far as what listeners can do besides researching their ER, asking for second opinions when they're in that situation, or using the app, like I said before, we do have a petition on our website that they could sign to, help demand change. But, contact their local legislator and, make them aware of this issue. That would be great. That's another thing they could do. I think raising awareness even among their community. They talk about it. Did you know? This is what we've been trying to do. We've had ad campaigns for years, just trying to make sure that parents are aware what the medical community knows, which is many emergency rooms are not prepared for children. It's crazy to me. It's like mind-blowing still.
Yeah.
It's a national crisis. It really is.
It is. And we've been talking to people on the Hill, but also talking to people at HHS. And there's definitely, between law changes and policy, there's also guidance, there's rules, and they should be required to adopt the standards and as a condition of participation in either the Medicaid program, Medicare, any of those things. And so definitely lots to do along those lines. But I really appreciate that, the awareness you're raising to this issue. And I think that it's a big deal to parents everywhere.
And I think we need to demand change. I really do, through policymakers and through our work with you, First Focus. I think just to add another thing in the meantime people can do, because as we know, government changes take some time, is we have a Sponsor Your ER program. For basically $5,000, we can go into your local community with the medical experts to train your local ER. It's another thing that's coming out of Our Baby that has had significant progress with. We had a volunteer just join us last year. She's on her second Boca hospital to make sure that her hospitals are prepared for children.
That's a great point for a very tangible thing that communities can do to just pool resources to make sure that their surrounding hospitals are up to date and have all the necessary supplies and access.
Which, again, goes back to my point that it's crazy that's coming down to parents and citizens.
Absolutely.
When, I work with doctors that always say, like, children are getting subpar healthcare than adults, and they're the most vulnerable, most important people in our lives. So why aren't we prioritizing them? Because they can't speak for themselves. So that's why I'm so grateful for this podcast and other people that are helping us raise awareness that children's healthcare is underfunded and it's not getting the attention it needs, and we can be doing better for our children.
One of the things we say at First Focus too is they're literally every issue. There's a kid angle. And I would say this is a perfect example that, when people think about emergency room care, they're probably thinking about car accidents and, whatnot. And there's this huge issue of major importance for children. And, the system's not paying attention to it, lawmakers aren't. And that's what we all need to change together.
And I think people don't think it can happen to them until it does. That's like, for me, like, I didn't think it could happen to me. And then all of a sudden it does. And you're like, what? And then you learn that your child is 4 times more likely to die if you go to an emergency room that's not prepared for children. Like, what? Like, this is like 2024 in America. Some of these statistics have been recently published. So I think the issue has always been well known and well documented that our emergency systems aren't totally prepared for children. But like these statistics that came out, now it's been like a few years, should be like sending off like emergency sirens to everyone. Like, we can do better for our children They don't deserve less healthcare than adults.
Yeah. Going back to even just raising awareness among parents. I remember when I became a first-time mom, when I was pregnant, you vet pediatricians, right? Like you're going on interviews and you're doing the little tours. Never has this conversation or this topic come up where even as a parent, just to be prepared based on where I live in the event of an emergency, where is the best place to go? And again, I'm very privileged to live in the DC area where we do have access to great hospitals and pediatric emergency care, but that's not always the case and it's not always intuitive. And so even for parents to just have this in their mind as, okay, this is another part of prepping to become a parent.
And one other thing I want to add, this is no fault of a general emergency room doctor who has been trained from birth to death. And I believe that they want to do good in the world and they want to help children. We support them and give training to them and believe that many times they can help children. This is no fault to them. This is the system. This is the hospital's not giving them ongoing training because they don't see children enough, or the hospital not having the right pediatric equipment. This isn't saying only a pediatric specialist can help children. It's making sure that every general ED doctor just has the right system in place for them, the right training and equipment and supplies. We're never going to have specialists in every ER, but we can have our systems designed for children, to stabilize and transport, or stabilize and have telemedicine, or, there's so many ways that we can make sure we're prepared for children working with general emergency room doctors. My ultimate goal is for Our Baby Foundation to go out of business in the near future, because that will mean that we created an effective EMS system for children everywhere.
We are with you. We would love someday for First Focus not to have to exist, because everyone gets that every issue is a kid's issue and is addressing the problems and puts kids first. And it's not just political, it's policies you have just in society as a general rule. We just fail kids again and again, and we don't think about their special needs. And I think if people would sort of ask that fundamental question, is it good for the kids? So I'm looking at ER, is it good for the kids? And people go, maybe it's not. Or if you're thinking about, education policy or whatever the policy may be, there's always a kid angle that is, just missing. And it's exactly as you said, which is that kids don't have voice. And so they're treated as an afterthought. And I don't think intentionally, I think everyone cares about kids, but it's just not in their face because kids can't speak for themselves.
Very well said.
So Phyllis, one thing we ask all our guests is we recognize that this is really hard work. And to your point, sometimes it's you feel like you're doing so much, but then it's still only a Band-Aid. And so in those moments when it does get really tough, is there a song or an album that you turn to for inspiration?
So one of the songs, Where Do the Children Play, I believe is a hopeful song because it's, children should live and enjoy life as intended. And this issue is life and death, but I choose to be hopeful.
Yeah, I love that song, Cat Stevens. And it's absolutely, that's where we should strive to get to. So we really appreciate you being on today and for your work and for your partnership. And we will do everything we can. And we encourage our listeners to take the recommendations that you had and to be engaged in this issue and all the issues having to do with children's health, but particularly this at this moment in time.
Thank you, Phyllis.
Thank you for your support.
We really appreciate Phyllis coming on today to talk about the circumstances of her, pulling together the Our Baby Foundation and all the great work they do, and really laying the groundwork for improving emergency care for all of our nation's children and how we must come together to do so. And so really appreciate that. And Messellech, do you want to talk about our partnership with Our Baby Foundation?
Yeah, no, I couldn't agree more, Bruce. That was a powerful interview. And, I always say when you're working on a mission that's so personal and powerful, you're just so dedicated. And I think you can see that in Phyllis's interview. And with that dedication, I think comes her frustration around this issue that she lays out. And I think anyone that listens to this and starts to kind of think about pediatric emergency care and what it looks like, there's a light bulb that goes off. And yes, so for this partnership, we are really looking at First Focus, we look at policy change and development in 4 progressive buckets, really starting with raising awareness and then moving on to, developing and promoting policy solutions, building that political will. And then, that last step, taking action, to really encourage lawmakers to make the right decisions. And we do a lot of that work in partnership with our C4 organization, the Campaign for Children, First Focus Campaign for Children. And so with this issue, working with Phyllis and the Our Baby Foundation team, we're really, at that first and second level of raising awareness and really developing and promoting policy solutions. But the good thing is we know what those solutions should be and what they should look like.
Yeah, if you've ever watched any medical drama, like ER or those kinds of things, you see crash carts in the emergency rooms. And from my experience, I used to work at the Children's Hospital Association. I worked at a public hospital in El Paso, Texas at some point. And if you go into an emergency room, there's sort of a standard crash cart for adults. But I think what people don't really understand is for kids, you need multiple crash carts because you need one size of equipment to intubate an adult. And for kids, you have to think about their babies and their toddlers, then their young children, and then their adolescents. So you have sort of the full array of sizes and weights, and consequently, you need multiple pieces of equipment for kids to make sure you treat them correctly. And if you're talking about, lines for, to take blood and those kinds of things, any of those things, you have to have a multiple set of supplies to treat kids correctly. And so consequently, you do need special training. And that's what often, as Phyllis has highlighted in her statement and in all her work, is missing in a lot of emergency rooms in this country, unfortunately.
Absolutely. I mean, she actually lists out, a pediatric readiness standard. They really have a list that they feel like every emergency room needs to have to really treat children.
Yeah, and so far in this country, there's been, some steps. We've improved. The federal government created the Emergency Medical Services for Children program, and they have grants to states to sort of try to educate people. But there's very few resources dedicated to that. And we know that most children in this country actually go to hospitals that are not pediatric ready. And that must change. And so one of the things that we're really excited about working with Our Baby Foundation on this is that we need to do right by kids. And that means creating policy change that requires that all hospitals meet certain standards. And so, as Phyllis talked about, there's sort of 5 key things that hospitals need, and they need to have appropriate training. So you need to have people who understand that children are not little adults. They have special needs. And so you need to have some pediatric training and understanding. You need to have the right equipment and supplies, as we talked about, the right personnel and staffing, the pediatric care coordinator, and then also the education and research. So ongoing education and research about what's different about the needs of kids. And, and I think some things that we would add is that you really do need child-friendly environments. And so you do need sort of a special area for kids that is very, separate and apart from what the adult ER environment looks like. And we need protocols for pediatric emergency care, readiness standards that are tied to hospital payments. Otherwise, they're just going to ignore it. So there's got to be incentives created to make sure that hospitals do it, and that these readiness standards are made public so that parents know that there is a different need to go to certain hospitals for ER care than others. So those are examples, I think, of things that we really want to make sure are set into law and policy.
Absolutely. If you are thinking of serving all humans from babies to adulthood, there should be a little wing or at least a few rooms that are dedicated for children, that the environment is also friendly. Again, when you go to a pediatric office, doctor's office, that environment looks very different than when I go to see my primary care doctor. And I think it's even more important in emergency situations when kids are already feeling extremely anxious and scared, that they're not also met with another added layer of anxiety because, they're sharing a room, or they may be next to somebody that's experiencing something that is scaring them, right? Because we all know that there's lots of different reasons why people come into the ER. And children need a space where they can feel supported and safe and put their mind at ease. So I think she really hammers it home with these major points around preparedness. And also, it is something that should be made publicly available. The same way now when you go to restaurants across different cities and they have a grade, there should be something similar where parents can at least know if they go online to a hospital's website or they enter a hospital, there's some indication that they are whatever level that they may be at. Parents do have a right to know.
Yeah. And there's not children's hospitals all across this nation. And so for all the sort of community hospitals, they really do need to meet these standards. And if not, then they should not advertise themselves as an emergency room, because they are not. They are not for children, and they will fail children. And that must change immediately.
Yeah, I mean, the statistics are staggering. The stat that Phyllis referenced, I believe it was 1,400 kids a year, that she also followed up to say that's typically probably underreported, right? Because these are documented cases. But I'm sure there's so many situations where a child goes misdiagnosed, undiagnosed, because of just a lack of training.
Yeah, and as we move forward in the halls of Congress and in state legislatures, I think that we really need to demand that hospitals do a better job of this. And as we move forward, they must, as a part of their reimbursement levels and as a part of even in the basic standards by which they participate in programs like Medicare and Medicaid, they should meet these pediatric readiness standards that Phyllis talked about in the interview. And if not, then they would lose resources, because there needs to be the right incentives for families to make sure that their children are appropriately cared for.
Absolutely. And I do hope that, through this partnership and in the next several years to come, that we can work to just really put Our Baby Foundation out of business, right? And give a mother some ease that this is not going to happen again. The whole First Focus team really feels her passion and dedication to this issue. And we're really working to solve it.
Yeah. In the interim, we would urge our listeners to look at our show notes, and we've got resources there to talk about what are these standards and things that people should know so that they're taking their kid to the best ER for them in the interim. But really, ultimately, we should get to the point where all ERs are appropriately caring for children. This is Speaking of Kids. Thanks for listening. I'm Bruce Lesley.
And I'm Messellech Looby. Special thanks to our guest, Phyllis Rabinowitz.
Speaking of Kids is a podcast by First Focus on Children.
Elizabeth Wyndham is the supervising producer, and Julia Wyndham is the associate producer.
Layla Nimatala is the advocacy and mobilization producer, and the senior producer is Jay Woodward.
Our theme music is Don't Look Twice by Sam Barsh.
For more information about this week's episode, go to firstfocus.org. You can find all of our links in our show notes.
If you have any thoughts, questions, or interest in becoming a First Focus on Children ambassador, email us at speakingofkids@firstfocus.org.
And please follow, rate, and review on Apple Podcasts, Spotify, or YouTube.
Speaking of Kids is produced by Windhaven Productions and Blue Jay Atlantic.